I realized early on in my nursing career that I was a face-to-face person and chose to work in home care before moving to rural palliative care. I was always amazed at how seeing people in their own home could provide answers to why they ended up in hospital. Things were also less clinical and more meaningful. I felt like I was able to be more compassionate and empathetic when people invited me into their home and into their lives. Fortunately, I was still able to meet with people during the pandemic. A year after it began, I was doing a home visit with one elderly couple. As I was doing a symptom management assessment, the husband's phone rang. I could tell he didn't understand what the phone call was about before suddenly he handed me the phone and said, "Can you talk to this person?" "Hi, this is Chrystal. I'm the palliative care nurse. Who am I speaking to?" "Oh, this is Tristen. I'm the nurse practitioner at the Cross Cancer Institute. I'm following up from the Lloydminster Chemo Clinic in regards to the telehealth meeting scheduled for this week." As we kept talking, we began to learn a lot from each other. She was doing a functional assessment to explore the value of chemotherapy for the elderly woman. I shared that I was following up after a hospital stay and happened to mention that a goals of care discussion had been started, but not finalized. We weren't surprised that we were both working with the same clients, but didn't know about each other, and we decided that we would work together moving forward. I offered to attend the telehealth meeting at Lloydminster in a few days. I wasn't sure how that conversation was going to work with me in the room and Tristen on the TV screen, but I knew that we needed to complete their goals of care and do what we could to keep them living in the same situation. As myself, the client, and her husband, and the chemo nurse sat down in the room, Tristen showed up on the screen. The conversation began by Tristen asking the patient how she was coping with chemotherapy. Then I filled in the details about the recent hospital admission and explained to Tristen how her spouse was providing a lot of care, and the conversation naturally turned to talking about goals of care. I've had many goals of care conversations, and they can be difficult. There can be lots of emotion and conversations about what ifs. People don't know how they feel until they are asked those questions, and eventually Tristen said, "I hear what you are saying. You are saying that you want your wife to have quality of life, not quantity of life." The spouse grabbed his wife's hand and looked at Tristen on the screen. "Yes, that is what I want." As a group, we finished the goals of care document and decided on respite care and additional home care supports. As someone who likes being in the room with people, that meeting was a good demonstration of how it is possible to have difficult conversations with someone on a video monitor. The following day, I went back to their home to drop off the goals of care document, and as I handed it to the spouse, he said, "So can I do one of those too?"